Welcome to Medicare Made Simple, presented by SeniorsPlus. I will be your host today. My name is Brandy Connor Vargason, and I am a certified Medicare counselor. That means I've been trained by the state and the federal government to counsel you on all things Medicare. This also means that I have taken a test to be able to do this. I am state certified, and it also means that I do not sell insurance, and neither does SeniorsPlus. SeniorsPlus is an agency on aging, which means we are a private non-for-profit, and we offer Medicare counseling free of charge to any beneficiary that has questions about Medicare. We offer free, unbiased Medicare counseling. So let's get started. How does Medicare make you feel? Medicare may leave you feeling confused, bewildered, lost, or unsure, but we at SeniorsPlus are here to help. So what will we be talking about today? Well, today we will be discussing what is Medicare, how to enroll in Medicare, the different parts to Medicare, things to be aware of, and we will be finishing up with some information about Medicare scams and fraud. So here are a few things you should know about Medicare. It is a health insurance program for people 65 and older, and for those who have been deemed disabled by the Social Security Administration. There's also some coverage for people with end-stage renal disease or ALS, and it is separate from Medicaid, also known as Main Care. In 2024, there were 66.3 million people enrolled in Medicare. 58.9 million were enrolled due to their age, and 7.4 million were enrolled due to disability status. As you can see, this is a very important and enlarged health insurance program. So how do you enroll in Medicare? Well, you can enroll in Medicare multiple ways. The first is to enroll directly online at www.ssa.gov. You can enroll over the phone by calling the Social Security Administration, or if you're a railroad employee, you can contact the Railroad Retirement Board. You may be thinking to yourself, wait, I'm signing up for Medicare. Why don't I just call Medicare? This is because Social Security keeps track of your work history, and Medicare is linked directly to your work history. So Social Security knows about how long you've worked and if you've had health insurance, and all of these items are key to being able to enroll you in Medicare. That's why Social Security handles the enrollment. What are the parts to Medicare? Well, there's 4 parts. You have your Part A, your hospital insurance, your Part B, your medical insurance, Part C, which are your Advantage plans, and Part D, which are prescription drug plans. So let's dive a little bit deeper into what each of these parts are. So Medicare Part A covers inpatient hospital services. So if you're admitted to a hospital and you are considered inpatient, Medicare Part A covers you. It covers inpatient hospital stays, including inpatient mental health, skilled nursing care, otherwise known as rehab care, home health care, hospice care, and blood products. So you may be wondering, okay, so what are some of the costs to Medicare Part A? Medicare Part A has no cost if you or your spouse work 10 years or more. While Medicare Part A has no premium cost, as you can see, there are some out-of-pocket expenses when you use Part A. If someone is admitted to the hospital, right off the bat, they have a $1,676 deductible. This is not a set number and can change based on various circumstances. The slide shows that if you have no secondary insurance, like a group-sponsored health plan, Part A can be expensive. This slide also shows how much you may pay per day for skilled nursing, as well as the first 3 pints of blood from the blood bank are no charge. So you might be thinking, well, what about the cost for Medicare Part B? So Medicare Part B covers your outpatient services. These are the things that we may use on a more regular basis. It would include visits with your primary care provider, blood work, physical therapy, and much more. They cover everything on this list, and as you can see, It's services that we are more likely to use on a regular basis. The cost for Medicare Part B this year is $185 a month. That is income dependent, and we will discuss this a little bit later in the presentation. And it does have an annual deductible of $257 this year. Part B also includes the listed preventative services. They are no cost to you, and I would like to highlight the first two bullet points: the Medicare preventative visit and the yearly wellness exam. These are provided by Medicare at no charge, but they are not physicals. The Welcome to Medicare visit is for someone who maybe hasn't had care in a while and needs to see a doctor to create a baseline. There's a limited time window to do this appointment, so if you want to utilize it, doing it sooner than later is best. The yearly wellness visit is not a physical, but it creates an opportunity for established clients to see their doctor when they do not go to their doctors often. So now you may be wondering, what are some of the things that Medicare doesn't cover? So some things that original Medicare did not cover are annual routine physicals, routine vision care, routine hearing care, routine foot care, routine dental, custodial care or in-home and nursing home care, and more. So in regards to routine physicals, Congress has decided that Medicare does not cover physicals. We aren't exactly sure why, but it has always been this way. With Medicare, they also do not cover routine yearly exams, unless your doctor feels you need an eye, hearing, or podiatry appointment. And in those cases, Medicare may cover a visit. And Medicare will only pay for dental in the event that it is medically necessary, like an accident, a car accident, or cancer. They may provide some coverage for dental repairs. And custodial care is when beneficiaries need some supports at home with things like dressing and bathing or cooking. Medicare does not cover these services because they are not considered a health concern, and therefore it's not covered by health insurance. So you may be wondering, what are the costs for Medicare Part B? As I stated earlier in this presentation, the 2025 premium for Part B is $185 a month for people who are new to Medicare. This is a monthly premium and can be taken directly from your Social Security each month, but if you choose to not have it taken out and want bills instead, Social Security will bill you quarterly. The Medicare Part B premium may differ based on income. Typically, if a single person made under $106,000 or a married couple made under $212,000, the premium stays at $185 a month. The amount you pay is based on your taxes from 2 years ago. So if you had an increased income in 2023, you may see higher premiums, but we will discuss this more later. Some other costs associated with Part B are the annual $257 deductible. Once the $257 is paid, you may be wondering, what do you pay? Well, after the deductible is met, you will pay for 20% for most covered services. But if they're getting outpatient mental health treatments, they could pay 35% of services. So to recap, most beneficiaries will pay $185 a month for their Part B. They have a $257 deductible, and after meeting the deductible, will pay 20% for covered Medicare services. These amounts represent those who do not have any other coverage. You can choose only Part A and Part B, but remember that there is no upper limit for the 20% out of pocket. This means if something traumatic happens and you need intensive care, you are paying 20% for all of it. This is why it may be good to hold secondary insurance. So you may be wondering, what if I have health coverage through an employer? Well, if the person turning 65 is still working and covered by their employer's health insurance, they can defer taking Part B. If the person turning 65 is not working, but covered by their spouse's employer insurance, they can defer taking Part B. There are no penalties for deferring Part B if the person turning 65 is covered by health insurance provided by an employer, either their own or their spouse's. And if the health insurance is linked with an active employment, the person turning 65 can enroll into Medicare Part A. It is a free plan and will provide hospital coverage that supplements their employer plan. So now you may be wondering, what if I have insurance through the marketplace? Well, the marketplace, also known as the Affordable Care Act, Obamacare, or ACA, when a person becomes eligible for Medicare, either by turning 65 or being deemed disabled by the Social Security Administration, they are no longer able to keep their insurance through their marketplace plan and must enroll in Medicare. Not enrolling in Medicare can lead to federal penalties that last the rest of the time that you have Medicare. This is due to these plans not being considered credible, so you must enroll in Medicare during your initial enrollment period to avoid penalties. So let's talk about these coverage options for the gaps in Medicare. In order to cover the 20%, the gaps in Medicare, or the services that Medicare doesn't cover, you have options. You have Medigap policies. You can go to a Medicare Advantage plan. Your employer may offer retiree insurance. You can maintain your current coverage with your employer. If you're a veteran, you may qualify for VA or TRICARE for life benefits. There's also the option to apply for MaineCare, and you can get the full benefit of MaineCare or a program called Medicare Savings. So let's talk about your options with Medicare. So with Medicare, there are two ways to have coverage. A key thing to note is that someone must be enrolled in Parts A and B in order to enroll in either of these two options. So let's talk about option one. Option one is for a person to stay in original Medicare. That's the red, white, and blue Medicare with Parts A and B, but it does not cover drugs. So you would need to get a Medicare Part D plan. Then, to cover the 20% after Medicare, you can choose a supplemental plan for an extra premium. Essentially, option one would be 3 separate parts, 3 separate plans that may be offered through different insurance companies. So you may have a Medigap plan through Anthem and a drug plan through Humana. So what is option two? Well, option two is a Medicare Advantage plans. These are plans that are based on Medicare, so you would still have the same coverage as A and B. They also have drug coverage and may throw in some extra benefits all in one plan. These are a lot like your employer plans or your ACA plans. You can start with one and switch to another option later. You just cannot mix options. So you cannot have a Medigap policy and an Advantage plan at the same time, or an Advantage plan with a Part D policy at the same time. So you may be wondering, what are my enrollment periods? Well, your initial enrollment period is that 7-month window around your birthday. You have 3 months before your 65th birthday, the month of your birthday, and 3 months after to enroll. If you're working or have a spouse that is working and have employer health insurance, you may not need to enroll, but you definitely want to ask Social Security if you need to enroll. If you needed to enroll and didn't at the time that you were eligible, you could face a 10% per year lifetime penalty on your Part B premium. And that is for every year that you were not enrolled in Medicare when you were eligible. There's also an annual open enrollment for drug plans. This runs from October 15th to December 7th. And this is your best time to make changes for your plan, review your current plan, and decide if any of the changes that were coming for the next year were good. Annual open enrollment for the Medicare Advantage plans, that also starts on October 15th to December 7th. But they have an additional open enrollment that starts on January 1st and runs till March 31st. This is just another opportunity to review plans, make changes, or return to original Medicare. 3 months prior to retiring, you should contact the Social Security Administration to enroll in Medicare Parts A and B. Medicare always starts on the first day of the month, so you may wish to stop working on the last day of the month so as not to have a break in coverage. So what's next? Well, we're going to dig deeper into your options. So we talked about option 1, which had your parts A, B, and D as separate policies. Below that was Medigap plans. In the state of Maine, there are a variety of plans available. These plans are not networked, so you can use these plans in all 50 states. But you may ask yourself, why? Well, this is because your Medicare card is your primary insurance, and the Medigap plans follow Medicare. They do not cover drugs, so you still need a Part D plan, even if you don't take medications. If you do not take one when you're initially eligible, you will get penalized. These plans do not cover dental or glasses, but may cover eye exams when referred by doctors. Can change plans at any point in the year, meaning if you're in one plan and find a plan with a lesser premium, you may be able to move into that plan. Some of the pros to Medigap is that they can be used anywhere in the United States and do not need a referral. They're also doctor-driven, so your doctor dictates your care rather than the plan dictating your care. The drawbacks are these plans can be expensive. The better Medigap plans for 2025 can cost up to $219 a month on top of the $185 Part B premium and drug plan premium. So here's some more information about Medigap policies. So the Medigap policies, Maine state law comes into play. If you apply for a Medigap during your 6-month open enrollment period, all insurers must issue you a policy. After this time, you may be limited on your carriers. Per state law, the level of coverage that is initially purchased is the highest level of coverage allowed. The state will allow a person to change a policy of equal coverage with a different insurance carrier or buy a policy with less coverage, but it does not allow a person to increase coverage in the future. So if you started with a lesser plan, you would not later be able to bump up to a higher plan if medical needs changed. Maine also has a 3-year guaranteed issue period, and this is when a person enrolls in Medicare for the first time. They have a 3-year period in which the Medicare beneficiary is guaranteed that they can go back to a Medigap. They have to enroll a person regardless of their medical history, but after these 3 years, you may be denied a Medigap policy due to your medical history. So we know original Medicare doesn't cover medications, so let's talk about Part D plans. So Part D plans, also known as your prescription drug plans, these are plans that go with the Parts A and B and Medigap policies. You must choose a plan within your initial enrollment period, or you could be assessed a penalty, and this is a lifetime penalty. Some plans have monthly premiums, but there are also some plans that have no cost premiums for 2025. Most plans have a deductible and copays, and the coverage gap for 2025, also known as the donut hole, has been removed effective 1/1/25. And we will discuss this a little more in the next slide. Some plans may not charge for generic drugs, and a one size does not fit all. The plans need to be personalized to the medications the person is taking. And the best way to do this is to log into Medicare.gov. You can input your medications and they can pull up plans, and you can review coverage and estimated drug costs. An open enrollment for Part D plans is October 15th to December 7th. So what are some of the costs associated with Part D? Well, Part D plans can range anywhere from $0 a month up to $156 a month for 2025. This is going to depend on the drugs that the beneficiary takes and what drugs are in the formulary. As I stated before, a great place to review plans and pricing is www.medicare.gov. As discussed in the previous slide, we also discussed the donut hole ended, but what does this mean? Well, for 2025, the government has limited the amount that you pay out of pocket for the year to $2,000. Prior to this, beneficiaries may pay upwards of $5,000 before Part D plans could cover medications at 100%. In 2025, they also introduced payment plans. To get more information about your insurance company's specific payment plans, you would want to contact your insurance. You can also reach out to SeniorsPlus for more information. With this, we have discussed option 1 for Medicare. Let's go into more details about option 2 and Part C plans. So Medicare Advantage plans are also known as Medicare Part C. You still need your Parts A and B, and you will still be paying the Part B premium. So the $185 a month will still be coming out of your Social Security. Part C plans provide all the same benefits as original Medicare. Medicare Advantage plans also have deductibles and copays. They work a lot like employer-sponsored plans or marketplace plans, and we have a variety of plans from HMO, PFFS, PPO, and SNP plans. They all do something a little different. HMOs have a strict network of providers, and you must see an in-network provider for care. Otherwise, the plan may not pay for the appointment. PPOs essentially have two networks: the preferred provider network, which may have lower costs, but you can also go outside of the network, but may pay a little bit more for your coverage. PFFS, there's none in our service area at this time, but basically it's a pay-as-you-go. They do not have a network, and they will pay for anyone, but the doctor is not under contract. So the doctor may accept you at one visit and deny your insurance the next visit. SNPs are plans offered for individuals that qualify for Medicare and Medicaid. They may have some special benefits included. With Advantage plans, you need a PCP and you may need referrals to see other providers. And what are some of the things to be aware of for Advantage plans? So some things to be aware of for Medicare Advantage plans. No, Medicare Advantage plans tend to be very affordable. They don't have much cost up front, and you can get into an Advantage plan that costs $0 a month. And you may wonder, how can they do this? Well, that's because the $185 a month that you pay for Part B is sent to the Advantage plan companies. The federal government also pays royalties to Medicare Advantage plans to provide these services. So they're making quite a bit of money from you and from the government in order to provide these services. So they can offer plans at no additional premium. One thing to be aware of is that many of these plans are limited to the state of Maine. Some plans may offer a passport program, and for this you would want to contact the insurance company to let them know you are traveling. So say you are a snowbird and move to Florida for the winter. Well, you would want to call your plan, and they can look up providers in that area. They may ask you for dates you'll be traveling, but these programs will allow you to be treated like you were at an in-state provider. Now we've talked about your options, let's talk about income-related adjustments to Medicare. As I mentioned earlier, your income may affect how much you pay for your Part B premium. If you earned a higher income and you have to pay more for their Part B, it's called IRMA, or Income-Related Monthly Adjustment Amounts. IRMA is related to your income from 2 years ago based on your tax returns. So for 2025, they would be looking at income from 2023. This will determine if you have to pay a higher premium. If you are assessed IRMA, you will have higher premiums for both your Part B and your Part D drug coverage plans. If a person made $106,000 or less, they will pay $185 a month. And if a couple makes $212,000 or less, they will pay the $185 a month. Any amount above this will have an increased premium. If you think this may happen to you and would like to know the amounts, you can call SeniorsPlus and we can assist you. You may be able to appeal the IRMA adjustment, and you would contact Social Security to do this. So with all these numbers being thrown around, you might be concerned that you can't afford Medicare. So what do? Well, there are state benefits that can help cover the cost of care, the monthly premiums, and lower drug costs at the pharmacy. They do not use a state recovery, so they will not attempt to recoup money from your state after you pass. They also do not have an asset test. The income guidelines for a household of one for these programs, particularly a program called Medicare Savings Program, is $2,413, and the monthly gross income for a couple would be $3,624. You can contact us at SeniorsPlus for more questions, or you can go to your local DHHS office to apply or ask questions. So let's talk a little bit about fraud. Well, fraud is actually a really, really big thing that occurs with Medicare. You as the beneficiary are the front lines. You may catch more fraud than Medicare does. And this is because you get monthly or quarterly statements and explanation of benefits and can dispute claims that you do not believe are yours. You want to ensure you are checking your explanation of benefits when you get them for any claims that may look suspicious or any services that you didn't receive. Some rules of thumb to follow. Medicare will never call you. You want to check all of your Medicare statements and insurance statements. You want to report any services that were paid for that you did not receive, and you never give out your Medicare, Social Security, insurance numbers, credit card numbers to someone you don't know. A very common scam that is going around right now is supposedly somebody from Medicare calling, claiming that you will be getting a plastic Medicare card. That is not happening. Plastic Medicare cards do not exist. So if you were to get one of those phone calls, do not provide any information. So as a quick refresher on how we enroll in Medicare, you can enroll online at www.ssa.gov. You can enroll over the phone by calling Social Security, or if you're a railroad employee, you can contact the Railroad Retirement Board. So here are some resources that may be beneficial to you in navigating the Medicare process. So there's 1-800-Medicare. This is where you can get information about your plans, about Part A and Part B, your claims, file complaints, all things Medicare you can do through 1-800-Medicare. There's a Social Security Administration, and this is really good to help you enroll in your Medicare. They can also determine your eligibility for Medicare and provide you information about whether you're eligible or not. And then we have legal services for the elderly, which includes their Part D appeals unit. So this unit can assist with Part D concerns if you believe you're being charged too much at the pharmacy, need to file an exemption for a covered drug, things like that. They also provide some assistance for things like Social Security appeals, housing assistance, things like that. And then you have SeniorsPlus, which we provide a wide variety of services, including the Medicare counseling. And if you need assistance, we recommend that you give us a call. Here at SeniorsPlus, we also have a wide variety of volunteer opportunities, from Medicare counseling to class facilitators to Meals on Wheels drivers. And our programs could not function without our volunteers. We certainly could not deliver all of the services that we do without them. So please consider volunteering, whether you have a few hours a week or a few days a week. And this concludes our presentation today. If you have any further questions or need further assistance, we ask that you call SeniorsPlus at 207-795-4010, or you can go to our website at www.seniors+.org and submit an electronic request. Thank you.